mix a little more in at the end. The other endocrine glands tissues. The adrenal glands are also called the suprarenal glands because they sit right atop the kidney. They are closely associated with the kidneys. They sit almost like a hat on each one. Hormones secreted come from two different areas of the gland. There's the adrenal cortex and the adrenal medulla. There are numerous hormones secreted by the adrenal glands, and those adrenal hormones play a role in maintaining blood sodium levels and responding to stress. They also contain sex hormones. So the cortex is the outer portion of the gland that secretes the steroid hormones, while the medulla makes up the central region of the gland and secretes amine hormones. The hormones we are going to discuss, particularly in the medulla, are epinephrine and norepinephrine, also referred to as adrenaline and noradrenaline. Epinephrine causes the heart to increase its rate and force of contraction. Norepinephrine increases the force of contraction and the rate. And I'll leave the rest of this for you to compare with one another. They're not always the same in different organs because of different receptors. Of the cortex, we have aldosterone, which regulates sodium levels, cortisol, which decreases protein synthesis, increases fatty acid release, and we'll talk about that again when we talk about stress responses in the endocrine system. The adrenal androgens supplement sex hormones from the gonads. They can be converted into estrogens. The hormones of the adrenal cortex come in three different zones, or produced by three different zones. The zona glomerulosa is the outer zone. It produces aldosterone and mineralocorticoids. The zona fasciculata is the middle zone. It produces cortisol and glucocorticoids. The innermost is the zona reticularis, and it produces the male sex hormones. Aldosterone is an important part of the renin-angiotensin system. It's a system that helps maintain normal blood pressure. Product of this system is angiotensin II, which increases blood pressure and promotes the secretion of aldosterone. Aldosterone conserves sodium and water. It's by osmosis, and it also helps aldosterone conserves water and helps get rid of sodium. You may have heard of angiotensin II because the receptor for the COVID-19 or SARS-CoV-2 is a receptor that binds to angiotensin. It's an angiotensin converting enzyme. Cortisol's secretion is regulated by a three-step pathway that exerts negative feedback on its own production. So the higher centers of the brain cause the hypothalamus to release cortisol-releasing hormone to the anterior pituitary gland, which releases adrenal corticotrophic hormone, which stimulates the adrenal gland directly, and then those feedback on each other. Disorders of the adrenal cortex include Addison's disease, which is due to an insufficient hormone secretion from the adrenal cortex. That results in electrolyte problems, glucose imbalances, dehydration, low blood pressure, fatigue, nausea, increased skin pigmentation. It can be fatal, especially because of the electrolyte imbalance. There's some speculation that John F. Kennedy may have had Addison's disease and would have died irregardless had he not been shot. The other one is Cushing syndrome, which is due to the hypersecretion of cortisol. Usually it's due to an adrenal tumor, excess secretion of ACTH by the anterior pituitary gland. Here we have muscle wasting, loss of bone, elevated sodium levels, water retention, increased blood pressure, puffy skin, and some abnormal depositions of adipose tissue in the face and back. And I am going to end that there.